Hi, my name is Chantel Lender and I'm an RN student, and today I'm going to be demonstrating an abdominal assessment. The first thing that we would do is our introduction, which includes wipes, which is wash your hands, identify your patient by at least 2 methods, provide for privacy, explain any interventions or procedures that will be performed today, and ensure the safety of your patient as well as the RN. After that, we would collect our medical history, which includes family medical history, the patient's past medical history, and then current signs and symptoms. After that, we would do our general survey, and after that, we would collect our vitals. With the introduction done, we would then move on to the actual abdominal assessment. The first thing that we're going to do is we're going to inspect. So what we are inspecting the abdomen for is the size, which is appropriate, the shape, which is concave, if the abdomen is symmetrical, which it is, the condition of the skin, which is intact, and the color is appropriate for ethnicity. We would then look for any abnormalities, which include bulges, masses, lesions, or any distension. None of that is noted. We would look at the hair distribution, which is evenly distributed across the entire abdomen. We would look for any movement, which includes pulsations or peristalsis, neither of which are noted. And then we would look at the umbilicus to see if the umbilicus is inverted or everted, and if it is midline. This umbilicus is inverted and it is midline. After we are completed with our inspection, we are then going to auscultate. The reason that we auscultate first instead of palpating is so that you can hear everything that's going on before you physically manipulate the abdomen and potentially change anything. So with auscultation, we're going to be listening for bowel sounds. But before you do that, you want to make sure that you clean your stethoscope, because your scope should be clean before you touch your patient. So take an alcohol prep pad, wipe it all down, make sure it's clean. Then you would come over and you would be ready to auscultate, where you're going to be listening for bowel sounds. Whenever we listen for bowel sounds, we are listening if they are present or absent. We are listening if they are hypoactive, normoactive, or hyperactive, and we are counting the frequency. We're going to spend 15 seconds in each quadrant. Unless we hear nothing, then we would spend 60 seconds in each quadrant. Okay, and after we listen to the vowel sounds, we are going to note if they are present or absent. They are present. We're going to note the characteristic, if they are normoactive, and then we're going to note the frequency, which is 16 times per minute. So after we are done auscultating, then we're going to move on to palpation. You would make sure that you have gloves on whenever you palpate. I currently do not have any at home, so I'm just going to note that I would be wearing gloves upon palpating the abdomen. We're going to do a light palpation. And whenever we are palpating, we are looking for whether the abdomen is soft or hard, if there's any tenderness, if there's any distension, and if there are any other abnormalities, such as masses, guarding, or any resistance. So now we are going to palpate the abdomen. And once you've palpated the abdomen, it is soft, there's no tenderness, it is not distended, there are no other masses, there is no guarding, and there is no resistance. So after we've completed the palpation of the abdomen, we would then take a look at samples that were provided: a urine sample, an emesis sample, and a stool sample. For each of these, we are going to be looking at urine first for amount, color, clarity, odor, and the presence of any blood. For emesis, we're going to be looking at amount, color, consistency, odor, and the presence of any blood. And then for a stool sample, you would be looking at amount, color, consistency, odor, and the presence of any blood. Once you have looked at all of those, we would make sure that we support the concept of infection control throughout the entire skill, and we would support the concept of patient safety throughout the entire skill. And after that, we are done with this assessment.